Some even more crazy news. People are reporting that Ozempic is helping them not just lose weight, but curb and fight their addictions. Hey everyone, and welcome here. If you clicked this video, you have probably heard about the new weight loss drug, Ozempic. Ozempic has been helping many people lose a ton of weight. However, you may not know about its other crazy positive side effects. We'll be looking into what those side effects are today. If you want to learn more about what Ozempic is, who is using it, how it helps with weight loss, and ways you can naturally stimulate this hormonal response in your body without the use of medication, check out this video. Quick disclaimer, I am not a doctor, nor have I taken this medication. The content in this video is purely based on research and for information purposes only. Okay, so remind me what Ozempic is again? Ozempic is an injectable semaglutide medication created by pharmaceutical companies to help combat obesity and type 2 diabetes. It does this by mimicking the action of a hormone called glucagon-like peptide 1, which can slow stomach emptying and impact hunger and satiety signaling. It's also thought to potentially affect ghrelin and leptin, the hormones that dictate appetite and cravings. In other words, it's a medication that prevents people from feeling hungry and can even help people eliminate their cravings. I started learning about the positive side effects of semaglutide medications when I listened to Dr. Jessica Cho on the Blonde Files podcast. It's a super interesting episode, by the way. I highly encourage you to check it out. Dr. Cho shares how she prescribes various peptides to her patients, including glucagon-like peptide 1. She shares that yes, it helps her patients lose weight, but even more importantly to her, it helps boost her patients' dopamine. Wait, what? Harvard Health defines dopamine as being the pathway to pleasure. It is a feel-good neurotransmitter that plays a role in the brain's reward and pleasure centers. It is often associated with feelings of pleasure, motivation, and satisfaction. Interestingly, people with type 2 diabetes often have lower levels of dopamine, which can lead to a decrease in motivation and an increase in depression. In a study published in the Journal of Obesity, researchers found that Ozempic increased dopamine levels in a part of the brain that is associated with motivation and reward processing. This led to a reduction in food cravings and appetite suppression. This increase in dopamine levels may explain why some people experience an improvement in their mood and motivation while taking Ozempic. Dr. Cho states that many people gain weight because they seek food for emotional comfort or a release from stress. Hello, emotional eating. Because semaglutides increase dopamine, Dr. Jessica Cho's clients actually feel happier and not only less hungry, but less emotionally drawn to foods that do harm to their body. Some even more crazy news. People are reporting that Ozempic is helping them not just lose weight, but curb and fight their addictions. Dr. Thomas Pitt, a neurologist, explains that this might be happening because Ozempic works on specific receptors of the brain to create a feeling of satisfaction. He says, so they make you feel full when you haven't eaten. They make you feel like you've smoked a cigarette when you didn't smoke one. So you get the satisfaction essentially from being full without eating. And you also get the satisfaction across the board, really, with anything that would be reinforced by the reward center. Obesity medicine specialist Shauna Levy also observed this trend with her patients, but in regards to alcohol. I have noticed that people want to drink less alcohol. I have also noticed a decrease in binge eating behavior. Taylor, on her podcast, Taste of Taylor, shares a similar experience in her interview with Dr. Jamie Gable. She shares that not only has she lost weight on her peptide protocol, but she says her relationship with both food and alcohol has completely changed. She shares that she used to obsess over food and constantly crave wine. And now she is experiencing a sense of freedom from both of these vices. She can drink a sip of wine and not want any more. She says it has completely changed her life. Some other positive side effects of Ozempic use include an improved quality of life, lowered blood sugar levels, improved digestive health, reduced risk of kidney disease, and cardiovascular benefits. Not only is this medication helping people feel more confident in their bodies, but it's also helping people feel happier and even improving their digestive, kidney, and heart health. I know one of the main pushbacks against this drug is that a lot of people consider it cheating to lose weight in this way. And I do agree that even if you take these drugs, you need to make lifestyle changes to help improve your health. But sometimes a medicine like this can empower people to actually feel confident in their bodies, or to combat their cravings, or to help them conquer some of their addictions, which may be the catalyst that someone needs to eat better and work out and sleep more and just take control of their health. Humans are complicated. Weight loss is complicated. Nutrition is complicated. Try your best not to judge someone who is trying to make just one thing in their life a little less complicated. And hey, maybe the doctor prescribed Ozempic, not for weight loss, but to help a patient lower their blood sugar, improve their heart health, or to help them increase their dopamine. Anyways, I'd love to hear your guys' thoughts. Are you on Ozempic? Do you know someone on it? Is it good, bad? What are your thoughts? Remember to not only give yourself grace, but to extend grace to others. We don't know everyone's story or struggle. Learn to listen. You might be surprised by what you hear.